Do you have a pain here, here, or here? In this video, I'm going to show you pain in those three areas may not be coming from those specific areas. We're going to look to your neck for neck pain referral patterns. Thanks for tuning in again. My name is Dr. John Saunders. I've been in clinical practice for 18 years, helping people get rid of their spinal-related health conditions. If you're new to this channel, thanks for tuning in. If you're the type of person that likes to take some ownership in your health and help yourself in the comfort of your home, please hit the subscribe button and the notification bell below. This channel is for you. When people have pain, the immediate thought is that pain is coming from where the pain is located. This is sometimes true. However, what we find in clinical practice is that oftentimes pain is coming from a tissue far removed from where the pain is being felt. If you suffer from headaches, oftentimes your neck is the culprit, especially the upper neck. We call those cervicogenic headaches. If you suffer from shoulder pain and you've had MRIs and ultrasounds to show you that your shoulder is normal, well, then the likely cause of your shoulder pain is coming from your neck as well. And finally, sometimes people will suffer pain between their shoulder blades. If it's coming from your neck, we call that cervicogenic dorsalgia. In this video, I'm going to show you how to rid all three of those problems in the comfort of your home. There are two joints in the back of the neck called zygapophyseal joints, or we're going to refer to them as the simpler term facet joints. These facet joints are responsible for providing stability and mobility in your neck. Sometimes these facet joints are unhappy. They can become inflamed, irritated from things like trauma, poor posture, even degeneration in those joints can cause problems. But oftentimes these joints can refer to areas outside the neck area. If you take a look at this diagram, you can see how some of these facet joints from the top to the bottom of the neck will refer to different places in your neck, your shoulder, and in your middle back between your shoulder blades. Successful treatment of referred facet joint pain has to involve treating the cause of the pain. One thing that should be noted, if you experience any discomfort when doing any of the things I'm going to show you next, please consult your health provider to make sure these exercises are okay for you. Now, how can you be specific in treating cervical referred pain? Here's a simple tip. Take your hand and you're going to place your fingers on the back of your neck and just wrap your thumb around your neck. This is going to show you the placement and the focus based on what you're trying to help. The top finger is going to be the upper cervical area. The two middle fingers will be the middle cervical area, and the lower finger will be the bottom part of your neck. So if you are suffering from cervicogenic headaches, the exercise and stretches I'm going to show you focus on the top part of your neck. If you have more shoulder issues, then I want you to focus on the middle part of your neck. If you have lower pain between your shoulders or along your shoulder blade, focus on the lower part of the neck. One of the first and easiest things you can do to alleviate acute neck pain is to either use ice or heat. Most people will have a preference, and what I recommend is often an alternating pattern between cold and heat in 15-minute intervals. Take a cold pack or a hot water bottle and place it on your neck for 15 minutes and then take it off for 15. Put it back on for 15 and off for 15, and one more time of 15 and then off for 15. The question always is what should you use? Research is divided, and what I've found in clinical practice over 18 years, patients will know what works best for them. This is the first step I would suggest when you're suffering from cervical facet joint irritation or referred pain. So here's one of the best stretches you can do to help with your facet joints. So take your hand and put it in the back opposite side of what we're going to stretch, and we're going to rotate our head and we're going to slowly bring it down to our knee. You should feel a nice gentle stretch in the back part of your neck. This stretch should be done 2 to 3 times a day for 20 to 30 second hold. And then we'll come back to neutral, and then we'll do the opposite side. Again, we're going to rotate and look down to our opposite knee. None of these stretches should be forceful. They shouldn't be painful. And you should hold and sustain that stretch for, again, 20 to 30 seconds. Now, if you have acute neck pain, you might not be able to go to full range of motion. You want to move to the point where if you moved any further, it might become painful. For some of you, that stretch might look like this. If that's as far as you can get today, then tomorrow you will likely be able to move further. The second stretch you're going to do is a simple rotation. So again, we're going to rotate to both sides within your tolerance, holding for 20 to 30 seconds, 2 to 3 times a day. Another great way to stretch through rotation is to take a small towel like this, put it around you like a cape, and what you're going to do is you're going to just place it on your shoulders, and you're going to grab the opposite side like this, and you're just going to take the same side and help yourself stretch. Now again, this should be done very gently. Don't choke yourself, just nice, smooth stretch. And it helps if you have shoulder pain to keep your arms in a comfortable position. One of my favorite stretches will involve the towel again. And remember, if you have cervicogenic headaches, you're going to focus on the upper part of the neck, the top finger. If you have shoulder discomfort that's coming from your neck, focus on the 2 fingers. And if you have mid-back pain coming from the neck, focus on the lower part of your neck. So for this, again, we're going to cape-like towel over our back, and we're just going to extend up. This is at the upper part of my neck, and you're going to hold this for 20 to 30 seconds. If you want to hit your shoulder area or the referred area from your neck to your shoulder, take the middle part of your neck, and you're going to more pull straight ahead and extend back over it. And then to hit the lower part, bring the towel's edge lower. And again, this one you're going to pull down and back. So for the lower one, we're pulling down and extending back. To hit the middle back referred pain area from the neck. The middle part of the neck for the shoulder, we're going to pull straight out or push straight out. And then those with upper cervical problems, we're going to pull up and extend. Now again, we don't want to pull hard. These are gentle, controlled movements. Really visualize the part of the neck you're trying to stretch. And now for the last 2 exercises, we're going to do a little bit of isometric contractions. An isometric contraction is a contraction where there's little movement. One of my favorite ways to do this is very easily, we're going to put our soft part of our thumb and hand just on our temporal bone, and we're going to rotate this way into our hand, and you're going to activate some muscles. You're going to hold this for 10 to 15 seconds. And again, as always, I always recommend to my patients and viewers that irregardless of the side that you experience the pain, you want to do both sides just to keep everything in balance. And then finally, last but not least, oftentimes a facet joint irritation can originate from poor postural patterns over time, this posture. So what we want to do for this one, I like this one as a very concentrated exercise and stretch. What we want to do to start is we want to pull our shoulders back. We want to take our chin and we want to tuck. And we want to hold this for 10 to 15 seconds. And then we can release. What is important on the chin tuck is making sure your shoulders are back, engaging your scapular muscles. You're going to pull your chin in, but make sure you don't flex your head down. I want you to keep your chin neutral or parallel to the floor as we do this. And hold for 10 to 15 seconds. It doesn't have to be an aggressive chin tuck or activation of the muscle. These should all be done smooth, controlled, and not pushing in to causing discomfort. Remember, this routine is meant to help with cervicofacet joint referred pain patterns. If you think you have a muscle issue, then click this video right here. This will show you a great routine to help reduce muscle knots and pain in the muscles around your neck. Another thing that can cause referred pain from the neck is cervical radiculopathy or a pinched nerve. Click on this video for a few stretches to help alleviate that. I really appreciate you tuning in. If you have a question or a comment, leave it below. I love to hear from you viewers, and I try really hard to answer every single one of your questions. I can't wait to see you in the next video. Until then, Be well.